That is Kitty Cat.
That is Kitty
Say
Kitty.
hello,
Hello, Kitty. That's our trouble buddy.
I know.
So guys, thank you for watching our channel, Texas ER Registered. This topic today is just spontaneous. This is about the strike, one of the biggest institution in California that's doing a strike, and we are travel nurses. This is one of the news that we got from the institution this week. As you know, guys, we are travel nurses, so this is what we have experienced. Now, we've been in Bay Area for almost 1 year now. Well, not really Bay Area in particular, but California. What came up recently, we are not included in this news from the facility we work in. This is a huge decision, probably for the institution we work, and we are going to be affected as a travel nurses because the hospital we work in is having a negotiation. They're bargaining. They're having a team to bargain for the first few months that they're demanding the increase of staff, not just because of the COVID, that they're trying to increase the staff of the COVID. They've had short staffing. The facility has made over 14 billion in profit. Meanwhile, nurses are chronically short staffed, unable to give patients the highest quality level of care. And that's what they, not presumably, but I'm sure this data has proven to their system. So right now, I think what it is, it's about, the facility has having a lot of meetings about, I think they're taking it seriously, that the employees are demanding that they have increased staffing, but they want to stop the travel nursing job. Because one of the main reasons for this strike is that the employee are demanding and encouraging the facility to hire new grads and permanent employees. And so I don't know what the rationale about it, but that is one of the topic, and that's one of the concern that they are the reason why they're going on strike, right?
Yes.
And probably increase the wages and benefits. And so we feel like as travel nurses, we feel like we don't know what our future, because this institution, we're not going to say the name, but this is the highest paying institution in California. And so my friend Beth here, sorry, I didn't introduce you guys immediately, but we both work together, so we know how we feel about these changes, these upcoming changes, how it's going to impact our future travel plans and our pay in California. Probably the strike will make a difference. Our agency has talked about we're gonna have, what do you call this? Incentive of travel nurses, but we really don't care about that because during the strike. But I'm not worried about incentive. I'm worried about future travel nurses, how it's gonna impact us, how welcome we are in California about this. This is one of the biggest institutions in California that hired travel nurses, and they pay well. And so this is what's going on right now. They're about to go on strike. There are different schedule on boating, different areas of California, some of them in Fresno, Richmond, Manteca, South San Francisco, Santa Rosa, and Walnut Creek, including Sacramento, San Rafael, Oakland, and Modesto. So this is huge facilities that are hiring travel nurses. Hopefully it's not going to impact us. If any of you have any comments about how you feel about these changes, and there are a lot of states, but California is one of the states that really pay well with nurses. Not that we get paid well. I think that California have wrong perception, well, not quite right perception about us as travel nurses, that we make so much money. Yes, the number is high. It's because our stipend is included in our income, but the living expenses here, if you're a travel nurse and you have home in your own state, we have a double pay. So if you're California nurses that you are permanent in California, us travelers were from Texas, we also paid our dues in Texas plus California. So even though the number is high in our quote salary, we still struggle to and we leave our family, we leave our kids, we leave our house, we leave our pets and everybody at home, our loved ones. It's not easy, guys. If you are California nurses, I hope you understand. You don't hate us as travelers. We struggle, for our family. This is the income that we need, not just for our family, but, some of us have debts that we're trying to pay, or, health that we're trying to catch up on our debts. You never know what everyone is going through in their life, that puts us in another states, so we are here to help California nurses for all of this. And so this strikes for you guys, I'm sure the union, I'm not so familiar with the union in California, but I'm sure that these are all input that the facility is listening to, our individual, each and every employee, nurses, or not just nurses, but in general employee of the facility that are complaining about travel workers. We are here to help you guys, and if you don't want us, there are a lot of states that will want us, and we are willing to help them. And so put a comments in our video, and let us know how you feel about it, because that, even though we are here just a worker, it also hurts our feelings that we are not welcome. They don't want us here and not hire us in their institution. We're not just here to sit down. Our work, we are ER nurses. It's very hard work. We take off running every day when we're working, and we're not lazy people. And so I hope you guys appreciate us for what we are here.
But excuse me, I'm sorry to interrupt, but I get it. Like, it happens everywhere. Like, nurses are overworked, but definitely not getting paid. That's what happens in Texas. The bad thing about Texas is we don't have union. So we can't talk to union and help us get a raise. Not like in California. So what I'm saying is, this is what we have decided, because nobody's helping us in Texas. We don't get paid like California. So we decided to do travel, and we didn't force ourselves to get hired in this hospital. They ask us to help us. So we're here to help. We're not here to take your job. We are just here to help. If we get paid, I think we deserve it, because we have done a lot of sacrifices in order to get this job.
Definitely.
We have to take a lot of considerations, a lot of stuff. We have to take it into consideration. I know we're doing a lot of sacrifices just so we can get a better job, because nobody's fighting for us in Texas. We don't have a union.
We have no union in Texas, so there is no such thing like California. You, by law, you have to have good break and good, like fair amount of break, and then your ratios, you are by law following them. We really appreciate that we are included in that kind of thing, but that's why we are here also, because like we are in demand in Texas, but every one of us has needs, and why we have to travel to make money, to have extra, just so we can we can satisfy what we need in our lives. And every one of us has different purpose, and so that's the message, or that's where we are with now with travel nurses. This is what's going on in California. One of the biggest institutions are going on strike. And so if you are traveling, and you might want to consider asking your travel agency about this, unwelcome from the facility, that we are not, they're trying to not hire, outsource and travel. So you guys, please put a comment below. Let us know what you think. Please subscribe to our channel. This is Beth, and this is Kitty.
This is Kitty Cat. Hello.
You guys take care. Have a good day. Peace.
Bye.